My name is Salma Abdelkawi, and I am a senior pharmacist and acting head of pharmacy in ERADA Center for Treatment and Rehab in Dubai. Thank you very much for taking the time to listen to my talk in today's webinar, and also for accommodating my having done a pre-recorded session for this webinar. So with that, we'll get into our topic of topical and other modalities for pain management. So I wanted to share not just the topical approaches for pain management, but also some other modalities, because a lot of the times patients will come to us asking for something maybe that's a little bit complementary, or maybe they don't necessarily want to start off with using medication as their first option. So I think it's always good to have some extra options in our toolbox for us to think about, or for us to maybe recommend to our patients, and as well as any family or friends that are asking for something other than the traditional ways of therapy. So with that, we will get into the objectives of the lecture. So as I said, we're going to be going over a few of the topical pain management options, as well as some of the advantages of that. And then we're going to go into some of the non-pharmacological approaches or modalities, and that will include some things like aromatherapy or essential oils, and some movement or physical therapy options as well. So these are some of the things that we're going to be talking about today. And from the advantages of the topical medication use is, first of all, to avoid the first pass hepatic metabolism that we sometimes experience with the medications when they are taken systemically or orally. We're also having less fluctuation in the drug levels being given to the patient, and we are able to use a lower total dose. It also allows us to be more specific with the treatment being applied specifically to the targeted area. So whether that's, for example, directly onto the painful shoulder or knee or hip. So it allows us to be more specific with our treatment. So some of the common things that we use as topical medications for pain management, you may have already heard about the non-steroidal medications and some things like the capsaicin and the lidocaine as well. So for the non-steroidal medication, like for example, diclofenac patches or cream, ketoprofen as well is sometimes available. So the non-steroidal medication topically will penetrate the skin and into the underlying tissues and inhibits the COX formation for local symptom reduction. So one of the benefits, as we said previously, of the topical medication is that we are limiting some of the adverse systemic effects by using it as a topical or locally applied medication. So the rubefacient, or something like the Acine, the Riparil gel as we know it, has a counter-irritant effect. So basically it works by vasodilating in the area, and it irritates a little bit the nerve endings in that area. And that helps to offset some of the pain in the affected area. It's generally well tolerated, so I personally haven't heard of any patient that's complained of Riparil gel or other brands of this type. So capsaicin creams and patches are available, and in general, people sometimes have the sensation that it's kind of a burning sensation or itching, prickling, maybe in the area that they've been applying the cream or the patch to, but it's a transient effect and it goes away relatively quickly. But other than that, there's generally few adverse effects from the capsaicin creams and patches. So lidocaine. So I think one of the most important things to keep in mind when we're using the lidocaine patches especially is that there is a chance for cardiac toxicity. And so from the medical side, when we're trying to explain to our patients how to use this safely, we need to be sure to tell them that it should be applied 12 hours on and 12 hours off. So this would be especially useful for patients who maybe need a little bit more attention when we're telling them some counseling points, to be sure that it has to be off for 12 hours to avoid cardiac toxicity. And just a hint, we have some MCQ questions towards the end, so this maybe is a point to keep in mind. So moving to some of the complementary approaches for pain management, and this is really the area that I really wanted to talk about, because I've had a lot of experiences personally and with friends and family who have used a lot of different complementary approaches to not just pain management, but also for their health and wellness in general. So I really wanted to add this as a part of today's talk, and I hope that it will be beneficial. So some of the potential benefits of complementary approaches is that they're generally low physical risks associated with them, and it's typically safe when it's provided by a properly trained medical practitioner. So acupuncture, uh, we've had, I think maybe a lot of us have had some kind of experience maybe with acupuncture, or have someone has gone to an acupuncturist and has had some kind of experience. And I've been one of the people who have really benefited from acupuncture. So part of the NICE guidelines actually is a recommendation to use acupuncture in clinical practice for chronic primary pain. So I think this is a good indication that we are in general moving towards a more accommodating medical school or medical system, where we are allowing now some of the complementary approaches to be added into our guidelines. So I think this is an amazing step forward. Acupuncture can also be an effective way of reducing low back pain and pregnancy-related pain. It also has an analgesic effect on the musculoskeletal pain, and it has the potential of lowering the required dose of opioid therapy medications, and therefore also the side effects associated with opioid therapy. Cupping, or hijama, as we may know, it's part of the prophetic medicine, and there has been some emerging research that has been showing that it has a local analgesic effect. It could possibly be due to decreasing the pain level in the area by improving the blood flow to that specific area. As I said, research is still ongoing in several studies, so definitely we need more research to understand exactly the mechanism behind this. Another complementary approach is homeopathy, and homeopathy has shown some promise for the treatment of pediatric migraine headaches. It also has been shown to decrease the use of non-steroidal medications used at the same time, or other analgesics in chronic musculoskeletal disorders. And it has the possible potential for application as a post-operative pain approach or complementary treatment. So essential oils, or aromatherapy, as we may have heard of it. Now, I know a lot of our maybe past information about aromatherapy is that it's something to be used in the spa, or it's for relaxation, or to be added maybe to your lotion or something like that. But there has been actually a lot of research showing that the effect of essential oils in pain management is quite significant, actually. And I think this could be something that's a very easy and affordable way that we can integrate into our communities, into our medical practices, for the benefit really of all of the people in that place. So essential oils have, in general, a positive effect in reducing pain, and they can be a safe addition to current pain management procedures. Typically, there's no adverse effects reported as long as the essential oil is used in a safe manner, and it's also a pure essential oil with no adulterants or anything else contaminating the products. So I've added here some of the active ingredients, or the active constituents, that have been researched, and the plants or the origin of each of those. So some of these plants or herbs we have commonly used in our traditional medicine approaches in different countries, where maybe your grandmother has told you that you can use clove, for example, for dental pain by just chewing it or boiling it and using it as a gargle, for example. There's been a lot of research about lavender, which we're going to be seeing in a couple slides, I think. So some of the things that we're using already are a kind of complementary approach, and essential oils are kind of like nature's superpower, I kind of like to say, where they are like the supercharged plants or herb, and we are able to benefit from that. So as I said, lavender. So there's been quite a bit of research done about lavender specifically in pain management, and a lot of the places or a lot of the ways that they've used lavender is by using it in recovery rooms after post-op procedures, and it's been shown to reduce the pain levels felt by the patients. So not only is it relaxing, and it also helps to support a healthy sleep environment, it can also have an analgesic effect. And it was found that it has an anti-inflammatory effect comparative to dexamethasone. So I think this is an interesting research paper, and I hope that there will be more research done about that in the future. Another interesting point I found about lavender is that naloxone, which we may know as the opioid antagonist or the opioid antidote, stops the action of lavender. So what that could potentially mean is that the analgesic effect of lavender is coming from some kind of opioid action, opioid-like action. So again, it needs to be researched further, but it's a very interesting research point. We have also black pepper. So the active constituent, one of the active constituents, I should say, of black pepper is piperine. And also like lavender, it's been shown that naloxone has been stopping the action of piperine. So this also could mean that black pepper potentially has an opioid-like action. One of the other oils I wanted to mention is wintergreen, because one of the active constituents of wintergreen is methyl salicylate, which we may know salicylate, so it has an aspirin-like effect. So some of these oils are really, really, very easy and simple to use, and ways that we can support ourselves and our health in general, instead of using maybe one of the non-complementary approaches. So I've added here a list of other essential oils, because we cannot talk about all of the possible essential oils and combinations also of oils that have a synergistic effect for pain management. But I wanted to add a few of the common oils that I found while I was researching today's topic. So I will just share, if possible, just a few little tips and tricks here and there. So the oils don't just have a pain management effect, but we can also use them to benefit our health in other ways. So for example, cinnamon, we may know is a very warming herb, and the oil of the cinnamon also is very warming. It also can be used to help manage our food cravings and to also promote stable blood sugar levels. Helichrysum is known as liquid gold, which is very interesting. It's coming from the name of the look of the flower itself, which is a nice golden color. And not only does it help manage pain levels, but it can also be used as kind of liquid band-aid in some situations where there's minor bleeding in very superficial layers. So I think it's amazing what we can do with some natural products and things around. So some other things that I wanted to mention, because it came up while I was doing a little research for this, boswellic acid, which is one of the extracts in the resin of a frankincense plant. And frankincense, for us in the Gulf, maybe we know it as Liban, coming from Oman and from other places around. Boswellic acid has been found as an adjunct in some of the pain management approaches. It needs definitely to be researched more, but it's something to keep in mind potentially. And it could be that you maybe use the frankincense as the essential oil itself. Caffeine. So we mentioned the non-steroidal medication. So in the market, you'll find already that caffeine is part of the combination of things that are in some of the medications that are available at the moment. And that's because it helps as a kind of adjunct in some pain syndromes. And if anyone has headaches, this would be maybe a good place to have a look at the research, because there's been some research that suggests that it could be helpful in tension headaches, migraines, and post-operative pain. And then there's some things like camphor, which can be it's found in some of the topical gels and creams that are available in the market, and it can help potentially to have a localized or topical also benefit for pain management. There are also several mind-body practices that have been researched. Those include things like biofeedback, different massage therapy techniques as well. So whether that's Ayurvedic massage, shiatsu, reflexology, or deep tissue, and many, many other things. Mindfulness, not just an approach for stress, but also can be helpful as a mind-body practice for pain management as well. And then there are other things that maybe we've heard of, like Tai Chi, Qigong, and yoga. So I know we said throughout that there's been a lot of research that has been done about complementary as well as topical uses for pain management, but I think there's a lot of future considerations for research that we need to have a look at. So what is really the effectiveness of complementary approaches for pain management? Is it possible that we can use concurrently the complementary as well as the modern approaches for pain management? And is there a way that we can create an individualized approach for pain management that really takes into consideration the individual person instead of having a generalized guideline? Now, I know I'm not available at the moment live, but I have this QR code. If anyone would like to send me any questions by email, I would be more than happy to answer them and to connect with anyone who found something beneficial today. And I really do hope that there was something that was beneficial today, whether it was the topical or the complementary. The time is a little limited, so I wasn't able to share everything about, for example, the essential oils and homeopathy and other approaches, but I hope that there was something that connected with you and resonated with you. Thank you again to all of the audience, and thank you for the organizers and for accommodating also that I was doing this as a pre-recorded. So thank you, and I hope to hear from you soon with any questions or comments about today's talk. Thank you.